Okay, does anybody know the answer to this one?
Smooth and cardiac muscle.
Right, so the answer to this one is D. So this first picture here, this is your skeletal muscle. Clearly, that's not one of the ones that has central place nuclei. Here's smooth muscle. So you can see the nuclei are like right around here, right there in the middle, and then cardiac. So this was, a very straightforward question. It's just testing your knowledge of if you know what the muscle tissue looks like. But yeah, very straightforward. You can expect a couple of those types of questions. So question 2, give you guys about 30 seconds. Okay, so meta-arterioles, vessels interposed between arterioles and capillary beds. What's the most appropriate answer here? Does anyone know?
C.
Yeah, C. So they possess precapillary sphincters. Meta-arterioles, they have both a proximal and a distal end. The proximal one, or the central channel, that's the meta-arteriole. The distal portion is the thoroughfare channel. So here it is right here. And then you can see right here is the precapillary sphincter. So the answer to this one would be that they possess precapillary sphincters. Are there any questions with that? Can you guys see this one okay? Identify the histological feature. So what is this arrow pointing to? Okay, so first of all, does anybody know the answer to this question?
Is it D?
It is D. So we are looking at the thymus, and we are in, like the outer portion, so that would be the cortex. It's not a lymph node. Red pulp, where is that located? Which organ?
The spleen.
That's the spleen. So obviously you can rule that out because we are not in the spleen. And then it's not the subcapsular sinus because we are on the outside here. So this would be a tonsil. And here is a lymph node. You can see the subcapsular sinus of the lymph node, the germinal center, the follicles. Just be able to differentiate these. And if Dr. Muscella went over these this morning in her review, I would be sure to go over all the pictures that she went over. I always thought that her reviews were probably the most helpful when it came to the pictures. And then here's the spleen. So you have your red pulp and your white pulp. And then do you guys remember like what happens in like the red pulp and all that? So like what's the major role of the spleen?
To recycle and clean out blood.
Right. So that's really what's going on here in the red pulp. You'll be, breaking down your red cells and all of that. So question 4, another just identify one. So I'll give you about 30 seconds. All right, does anyone want to shout out the answer to this one?
Is
It's
it
a
B?
lymphocyte and a monocyte.
Yeah, and do you know which one is which? What's this one here?
Lymphocyte.
Right, and then this one would be the monocyte. So lymphocytes are they're really easy to identify. They're just like the best way I can put it is look like, like a blue or like purplish type like ball. Um, Here are some other ones. So the neutrophil, they always have that like trilobe nucleus. Again, here's your lymphocyte. It's very dark. Eosinophils are always going to look a little more pink. And then, yeah, the rest are, that's another pretty self-explanatory one. So number 5, what is the line that bisects the light band and muscle? Okay, what's the answer to this one?
Is it
I
B?
band?
The I band, right? Or no, actually, the I band is the light band. So what's the line? Yeah,
The C line.
yeah. So the light band is the I band. Then what's the dark band?
A band.
Yeah. So your dark band would be your A band, and then you also have a line going down the A band, and that would be your M line. So here's a picture of it. So here's your I band. You can see your Z line going right down here, which was the answer to that question. And then right in the middle, so here's another A band. This is another A band as well. You have your M line, and then there's an even more centered zone in the M line, and that would be your H zone. Okay, so I would be familiar with a picture like this. I think we had a couple of questions that probably used about the same exact picture. So just be familiar with that. I'm sure you guys have all gone over muscle like beforehand, but they like to test on that. No, sorry, I kind of just gave you guys the answer there. Okay, so question 6. Hopefully you didn't all see the answer, but I'll give you like 30 seconds. Okay, does anybody want to shout this answer out?
Is it a lacteal?
It is a lacteal. So again, this was another just straightforward question. Not much creativity went into this one, sorry. But here's your picture of it. So this here would be your lacteal, and these are going to be all of your villi right here. And so your lacteals, they're not just in the jejunum or any, they're in every single villi. Okay, question 7. All right, I'll give you guys a little longer on this one. Wait, I need to give you the picture, don't I? All right, does anybody know the answer for this one?
C.
Yeah, C. So you're looking at number 3 here. And what is this called?
The germinal center.
Yeah, so not only was this asking you to identify the um, where the B cell is going to differentiate, you had to also identify it in the picture. Um, and then, so this is kind of, this is an immuno question, goes with Dr. Mickle's stuff. And just like a heads up for when you take immuno next semester, he loves to ask things like this, like where is the B cell going to go? They will always go to the germinal center, whereas T cells, they go to like, what's that called? The Kenny or Sam, you want to help me out there?
They're usually in the like that paracortex, and then they kind of meet, and
Yeah,
yeah,
yeah, all that. So,
yeah.
yeah, so this would be your germinal center. And then this also could have just been like what type of like tissue are you looking at here? So if they didn't specify lymph node, you had to know that the germinal center is made in the lymph node. These are off numbered. I just realized that. Okay, so next question. All right, so what layer of the GI tract contains the gut-associated lymphatic tissue, which is also called GALT? Does anyone know? So the answer here is going to be the mucosa. Your GI tract has a lining of epithelium, the muscularis mucosa, and the lamina propria. So the GALT will be located in the mucosa. Are there any questions with that? So right here. This would be your submucosa here, your muscularis externa, Peyer's patches. So just be familiar there with the GI tract. Then question 9. All right, so what is actin? Who wants to yell that one out?
A.
Myofilament.
Yeah, it's a myofilament. It can't be myosin. They interact with each other. The rest of those just really didn't make sense. This is a very easy question. So the myofilaments are the contractile proteins, so that's both actin and myosin. Um, the thin filaments are actin, where myosin is going to be thick. The muscle cell is a muscle fiber. So those two words are synonymous. Again, just a very straightforward question. This is what that would look like. And then which fiber type gets its energy primarily from glycogen? I'll give you a little bit here. Okay, what's the answer to this one?
A.
The answer here is B. So
Oh.
all three of these are types of skeletal muscle fibers. So you have red, white, and intermediate fibers. So here's the explanation here. So your white muscle is your glycolytic. They are fast. So, they're the ones that are going to be like active whenever you're like doing like quick movements. Red muscle, that's your slow. So that's mostly like your endurance ones. They fatigue very slowly, where white muscle, that's going to fatigue pretty quickly. And then you have your mixed or intermediate. So the white ones are the ones that store glycogen and they are anaerobic. Any questions with the first 10?
I think you went over that concept in physio as well. Like white muscle, like I remember she used the example was like the eyes. Like you can only really look around really quickly for like a couple of seconds before your eyes get really tired. Whereas in like your muscles are usually like red muscle, like you can hold a box for like, an hour, 2 hours. So yeah.
So Kenny, are you next? Do you want to share your screen or do you want me to keep sharing?
You could just keep going
Okay.
if you don't mind.
Yeah, that's fine. Oh, I don't know what I just did. I'm very sorry.
All right, question 11, guys. Which of the following is not true regarding the endocardium? So what do we think?
I think it is A.
It's A, right?
Yeah.
Right, so it's not true. There's not abundant adipose tissue in the endocardium. So the endocardium is going to be found inside, lining the inside of the heart. And it's actually the adipose tissue that we find, and the glycogen stores are going to be found in the epicardium. So on the outside of the heart is where this is a good image of the epicardium, myocardium, and endocardium. So you see the epicardium has the abundance of fat that cushions the heart. So the other layers, we also have the myocardium, which is a lot of smooth muscle, and the endocardium is lined by endothelium. So another question that she could ask is, what type of epithelium are you going to find in the endocardium? And it would be simple squamous, because it's all going to be very flat. It's not going to be secreting anything. It's not going to be tall or cuboidal or columnar. Nothing's going on. That kind of absorption is going on. It's just squeezing the blood out into the circulation. what is the connective tissue called which surrounds an individual cardiac muscle fiber? So what do we think?
Endomysium.
Endomysium, right? That should be a pretty easy one. All the other ones are explaining the layers of the heart, as we just discussed in the last question. So that was a nice like segue into it. Just go down to the picture. I think, Holly, you can see a little bit better. Yeah. So here we have the perimysium, which is going to be the connective tissue encircling a bunch of cardiac fibers, while endomysium is going to be the immediate one that's touching every single fiber. Then you have the epimysium, which is on the greater aspect, even more globally, surrounding all of them. So it goes, remember, endo, peri, epi. That could be something that she'll pick on you, and it'll be endomysium or endocardium. And that's where you have to make that distinction between what she's asking for. So this one is a little bit clinical correlate. I believe she discussed it, so I don't think you guys should have a problem with it, but it's good to get a sense of what's coming. Any ideas? D, yes, in the chat, D. That's correct. So it's going to be the absence of ATP that's preventing the detachment of the myosin heads from the actin. So upon death, you have the mitochondria obviously stop producing ATP, and it's that essential ATP that binds to detach the actin and myosin cross bridges. So that's important. I don't know if you guys went over it, like the power stroke, maybe that would be in the next one. But it's essential to have that ATP to detach those heads so that you can get ready for the next contraction. Otherwise, if that ATP is not available, the actin and myosin remain connected to each other and they stay in a contracted state, which is why you can get that rigor mortis phenomenon after death. What do you guys think for this question?
E.
B, right? Muscle satellite cells. So those are going to be the reserve muscle cells that are always ready to go and differentiate into new muscle cells. All the other answer choices may seem like they could be right, but ultimately you're not going to have hyperplasia. You're going to have hypertrophy of the other muscles, but that's not answering the question. It's asking what will replace them. So the other ones may hypertrophy, but in order to replace it, you're going to need to dip into this reserve satellite cell population. All right, what do we think for this one?
A.
A, right? It's going to be a B lymphocyte. So the B lymphocytes are going to ultimately differentiate into plasma cells, and the plasma cells are going to be the ones that are producing antibodies, and the antibodies are going to circulate in the humors of the body, so all the liquids of the body. That's why it's called humoral immunity. So those are antibodies made by plasma cells, ultimately that differentiated from B lymphocytes, are going to circulate in the humors of the body. It's not going to be T cells. T cells are for cell mediated. You'll learn more about this later. Reticular cells are a type of fibroblast, and NK cells and macrophages are part of the innate immune response. as they try to engulf and phagocytose pathogens. So those are not going to be involved in the humoral immunity, as it were. Any ideas for this one?
D.
Sorry, what was that?
D.
D, yeah, spectrin. So spectrin is going to be the one that keeps the biconcave disc shape. All the first two are actually the subunits of hemoglobin. Porphyrin is for the heme molecule, and alpha actinin is in smooth skeletal muscle. But it's going to be a spectrin that, if you have a defective spectrin, you could have sickle cell anemia, which the red blood cells lose their biconcave shape, so they're not able to squeeze through the smallest capillaries as easily. What do you think for this one?
C,
C.
botulism.
See, botulism, yeah. So anything, this is just for future reference, anything that has to do with, questions 10 that has to do with canned foods, it's almost always going to be botulism, like 99% botulism. So botulism is associated with improperly canned products, and it's about the release of, it blocks the release of acetylcholine at the neuromuscular junction. Myasthenia gravis, I don't know if Dr. Wade has gotten that into it with you yet, but it has the etiology of that disease is autoimmune antibodies to the acetylcholine receptor at the neuromuscular junction. ALS is not required, right? It's genetic. So is Duchenne muscular dystrophy, and heart attack has nothing to do with this question stem. What do you think?
A D.
D,
Right.
right? Spleen. So recycling of iron and heme, that immediately has to click in your head that we're talking about the blood. So the spleen is the only lymphatic organ that filters. It's not the liver does some of it too, but the majority of it is done by the spleen. And make sure you know the difference between white pulp and red pulp, the sinusoids, the fact that it has no connection to lymphatics. There's only one arterial supply that brings in the blood and filters the blood. Splenic macrophages, that's a key cell type to know that you're going to find in the spleen. I don't know, I think that's it for this question. Skip that one. So any ideas for this question?
B.
B. So yeah, so what kind of cells do we have here? Does anybody care to guess? What do we have on the left?
Eosinophils.
Right, on the right we have an eosinophil, and on the left,
Neutrophil.
a
Neutrophil.
neutrophil, right? So for the answer choices, we have, just go back up, Holly, for a little bit. Thank you. So for the answer choices, B, histamine. So what kind of cells are we going to find that are going to release histamine?
Plasma.
It's actually going to be mast cells.
Basophils. Oh,
Yeah, mast cells are going to be the one that contain histamine granules. What about von Willebrand factor? What kind of cells are we going to find those?
platelets.
Platelets, right? But it's mostly from the epithelial cells. So in response to injury, you're going to have the endothelium releasing von Willebrand factor, which then attracts platelets to that area so they can form a clot. And antibodies, what kind of cells produce antibodies?
Plasma.
Plasma cells.
Right, so plasma cells. So do you guys have an idea of what plasma cells look like? You're going to have they're going to have a small nucleus with a very large cytoplasm, because most of the cellular architecture is going to be geared towards making antibodies. So it's going to be a lot of smooth ER, rough ER, and Golgi. So that's ultimately not what we have here. So what we have here is a neutrophil and an eosinophil. And we know it's an eosinophil on the right because of the bilobe nucleus. We see those two blue, right? We have to see those two, that bilobe nucleus, and then we also see the eosinophil. So eosinophil is going to be very red. And it shows you all the granules there that are staining very, very red. And those are ultimately going to be all denoted crystalloid bodies. So the answer should be A. And that's directly from your slides too. I didn't provide that here, but it's eosinophils. It says bilobe nucleus, crystalloid body. It also contains, she could ask you anything. It could be crystalloid, like the answer could be crystalloid, but it also contains histaminases. So histaminases are used to neutralize histamine. It also contains major basic protein, and it's also it's elevated in allergic reactions, and especially to parasites. So if you have a parasitic infection, you're gonna have you're gonna have eosinophilia. But ultimately, this is gonna be something that crosses into Dr. Mickel's realm of immunology, and also what Dr. Truce has taught you guys already. So it's important to know what these cells look like and what's inside these cells, because she could very well just pick an image just like this of one cell and ask you what it is or what it does or what kind of situation you would find elevated numbers of it. So it's important to really understand that hematopoietic stem, like the tree that tells you which one derived from what they kind of look like, and what kind of situations you're going to find elevated levels. And that's it for me.
Okay. All right. Yeah, you could just stick to you. So which of the following differentiates the two prominent structures shown below? I'll give you a couple of moments to do that. All right. Does anyone know what the answer is?
D.
Yes. So the answer is D. So looking on the left, we're definitely looking at an artery, and on the right, we're looking at a vein. So the biggest differentiator, at least, I mean, it should be pretty obvious, but like the artery has to push out the blood. You have very high blood pressure, so that the artery needs a lot more smooth muscle. So that tunica media is very thick, and that's going to really, it's going to be very important to kind of help push that blood all the way out to the body and to the periphery. The veins kind of get a lot of help. You know, we have venae comitatus, which, and like these kind of veins that'll be kind of milked through your muscle to help kind of push that blood up. So it's muscular structure is not that high. So the tunica media is not as more prominent on the veins. You can even see in the tunica intima, which will be in that inner layer. You can kind of see like it's really dark. You can kind of tell that as well to like help you differentiate between artery and a vein. So keep an eye out for that. It should be pretty simple. One more thing I want to mention. A lot of arteries do have vasovasorum, so maybe she might point to that. The arteries are so big, like they have their own blood supply. Like that much can happen.
She's 100% going to put a picture of either an artery or a vein and ask you to identify it. So make sure you understand what they look like, what features to clue.
So for those specifically, I would call them large, just because the tunica intima looks really big, but I'm not entirely sure on that. I would definitely check up on your notes to look, but I'm not entirely sure. from this image, I think they were the large arteries. But usually it's the vasa vasorum that's going to tell you if it's a large artery, because they need their own blood supply. That's how big they are. So I would definitely check again on that, but I'm not entirely sure for this image. But yeah, if anything, I'll check it out, and then I'll let you guys know.
Could you point out the vasovasorum on that image again, please?
So usually they tend to have it. I can't even find it on that image. There's like, if you Google it, like you'll get an image that has like a really good vasovasorum on it, and it's its own blood supply. Like you'll see it like on the periphery of the artery. I'm not entirely sure if I can see it here.
All right, I'll Google it.
Yeah, it's one of those. If you Google it, you'll get a really good like textbook image of it. But yeah, let's go to the next question. Okay, so you guys know what A is and what B is? So can somebody tell me what A is? Well, is the answer true or false? Let's start off with that.
False.
Yes, the answer is false. So A is not a venule. You see it, it looks a little cloudy. It's not, you don't see individual red blood cells. So A is definitely, you're looking at a lymphatic vessel. So lymph, you're going to realize is kind of like thick. It's kind of like, it's sort of like, it has a whitish color. It's if you've seen like lacteals, I'm sure you've seen the images of them. They're like milky. So you can see with A, like, even though it's a lymphatic vessel, it's very thin. They are going to tend to be very thin, and would be, that's a venule. It's as thin as it possibly gets. So how do you differ adipose tissue from lymphatic? Adipose tissue, you're going to see, is very clear, but it's adipose cells are their own, very distinct. This is more just like a lymphatic vessel. I don't know if that's what the question was asking. I'm sorry. Yeah, it's its own separate cell. So if you look at adipose tissue, you'll see it a lot in like liver with people who drink a lot. It's very obvious. Let's go to the next question. So remember to identify the blue arrow. I remember on a question, people were misidentifying which arrow. This is identify the blue arrow.
Is it D?
Yes, the answer is D. So immediately, so A is pointing to, like the green one is pointing to goblet cell. So we know it's not connective tissue. We know it's not Hassel's corpuscle. We're not in the thymus. It's definitely D, Peyer's patches. Definitely know what this looks like. And yeah, we can move on from there. Okay, so question 23.
Let's see.
Yes, so we are looking at the heart. It can't be liver, colon, or a blood vessel. But can somebody tell me what that blue arrow is pointing to? What's that differentiating factor that's telling you that it's a heart?
Intercalated discs.
Yeah, there you go. So that's going to be that key factor. There's like a list in Junkera in chapter 10. There's like, tells you, breaks down skeletal muscle, cardiac muscle, and smooth muscle. Intercalated discs, you're already thinking cardiac. So, and if you see striations, you should be thinking either cardiac or skeletal. But this is the key differentiator. between skeletal and cardiac. All right, next question. So pluripotent stem cells. Keyword is pluripotent. Does anyone know the answer? Yes, the answer is A. So we don't, our body doesn't have totipotent stem cells. Those are like the stem cells that we have like as an embryo. But so pluripotent cells are cells that like can make, you usually have asymmetric division. You want to make sure that your body is maintaining its stem cells, but also going to other cells that are going to become the later on that's going to differentiate. So that's like the major thing that you should know about pluripotent stem cells. Let's go to the next question. Okay, so now we're talking about progenitor cells. Does anyone know the answer? Okay, so yes, the answer is B. So progenitor cells are not going to be found in the spleen. They're not in the yellow bone marrow, they're in the red bone marrow. And they do not give rise to both the lymphoid stem cell and the myeloid stem cell. So you can see that the erythropoiesis, thrombogenesis, and leukoptosis, I don't even know what that says, but they all sort of have their own progenitor cells. So there's going to be these factors that are going to come into play that's going to push its own progenitor cell to either go into forming red blood cells, megakaryocytes, or granulocytes. So, neutrophils, eosinophils, basophils. So just know that they give rise to colonies of only one cell type. So that progenitor cell for that erythropoiesis is only going to become a red blood cell. The one for thrombogenesis is only going to become a megakaryocyte. And then for the leukocytosis, it can kind of turn into like a couple of things. But the question was asking for red blood cells. All right, so let's go to the next question. All right, now erythropoietin, EPO. Does anyone know the answer? No, it's not C and it's not D. So I'll explain each one. So it's definitely not A. It doesn't do white blood cells. B is not found in the kidney and liver. So you guys I'm pretty sure Dr. Wade has already talked about erythropoietin coming from the kidney. A lot of kidney cancers like renal cell carcinoma. One of the big things you're going to see is somebody who has really high blood cell count, red blood cell count. It's called polycythemia vera. So it's one of the things you'll see like with somebody who has kidney cancer. So is necessary for homopoietic progenitor cells. This is not true. I'll get to it when it goes down to the chart. D is found only in the liver. Again, it's not in the liver. We're doing this from the kidneys. And the answer, therefore, is E. It's found in the peritubular endothelial cells of the kidney. So going down, we can see that it's not for progenitor cells. So you can see what EPO does. It's mitogen for all erythroid progenitor cells, whereas then the question was asking for just like specifically just asking for hemopoietic progenitor cells. These are erythroid. So does that make any sense? I'm gonna
What was
go
the
with
answer to that question? Sorry, just one more
the
time.
answer to that is E. So your kidney is kind of what tells you whether or not to make blood cells. So there's kind of a lot of like well, it goes from your heart. Your heart kind of tells like when you have low blood pressure, and then it kind of sends a signal to your kidney that's like, hey, we're not having enough blood. Let's start forming more blood, and that's how erythropoietin is formed. These come from the peritubular endothelial cells of the kidney. So you can go down, take a take a picture of this. I think it's in your textbook as well. I took it straight from the textbook. So if not, this is what all these things do. Do remember what these do, especially stem cell factor. And stem cell factor is for all hemopoietic progenitor cells, erythropoietin and thrombopoietin. She did ask like, one question about that last year. I remember like remembering this, and I was like, I don't know why. And then it showed up, and I was like, there you go. Like, I'm glad. So, remember this. Don't worry about like the interleukins. Don't worry about that. That's for later. You guys will hit it. But the ones that are bold, definitely know those. All right, let's go to the next question. So it's saying the question asked, identify the following image. You guys should know this by now. What's the answer?
B.
Yes, the answer is B. So there's no striations, there's no intercalated discs. You have a central nuclei. So, yeah, this is definitely B. That's kind of like a gimme. She's gonna give you a couple of gimmies, so don't worry about it. You should be quick, done and easy. All right, let's go to 28. All right, now what is this? You can see that there's peripheral nuclei. I don't see any intercalated discs. What cell is this?
C.
Skeletal muscle.
Yeah, so this is skeletal muscle. Okay, all right, let's go to the next question. All right, the epicardium. Give you a little bit of time for this. Does anyone know the answer? I mean, we kind of already went over it, but repetition is always good. So the answer is
C.
Yeah, C. Kenny already went into it. Just remember, it's contains the fat and adventitial fat. So this is also another table. Take a picture if you need to. It still tell you what's in each area. So, all right, let's go on. All right, so these are things you should know. I'm gonna kind of go over this pretty quickly, but this is kind of going into later on what you kind of really need to know going forward, and for immuno. So definitely know what Hassel's corpuscles are, what they do. You know they're in the thymus. They're in the medulla. They're not in the cortex. So you should know what they look like. This is, I think, definitely directly taken from one of your slides, I believe. So let's go. Let's move on. Yeah. So again, know what Hassel's corpuscles are. That's going to start out by saying if you have not read Junkera's textbook for this lecture, for I think chapter 14 for the immune system, I highly recommend it. I don't know how Dr. Mickel's lecture went. I don't think it. I mean, his lectures to me were just not great. You learn from the textbook. You will always learn from the textbook with him. So B cells and T cells, know where they mature. You know B cells are going to be maturing in the bone. B for bone, T for thymus. T cells start in the bone marrow, but then make their way into the T cells, into the thymus. Go up a little bit. So like I can mention, yeah. So maturation for the B cells occurs in the bone marrow. T cells occurs in the thymus. And then in the periphery and secondary organs, that's when they get trained. So here when it gets to the lymph node, that's where the B cell is kind of looking out. for antigens. That's kind of like everything sort of goes through your lymph nodes. And if you guys have ever gotten sick, had a throat infection, if you wonder why your doctor's touching your throat, he's checking to see if you have lymph node enlargement, because those germinal centers, they're proliferating, they're getting larger. So your lymph nodes are swollen. That's how you know somebody has an infection. It's also going to tell you if somebody has cancer, metastatic cancer, because cancer will then hit the lymph nodes. They're going to start proliferating there, and all of a sudden, like, it's bad news. All right. I digress. All right. So clonal expansion, yeah, know where that occurs. You guys know it's in the germinal centers. She's going to ask you, might get an image that's going to be like, what's occurring on in this area, and that's going to say B cell germinal proliferation or T cell germinal proliferation. T cells don't do that. It's the B cells. All right, let's go to humoral versus cell mediated. Kenny went over this. Humoral, you should already be thinking antibodies. They're soluble. They travel in the humor. So one thing to know is that antibodies are going to be doing antigens, which are outside the cell. These are going to be things that are going to be floating around. You're going to get more into it when you get into immunology, but antibodies are going to be helpful for multiple things. For neutralization, you're going to have them for, opsonization. You're going to have them for a multitude of things. But a lot of times it's antibody-dependent cellular toxicity. You need those antibodies to latch on to whatever parasite or bacteria or whatever, mostly bacteria. It's going to latch on, and that's going to say, all right, macrophage, do your thing, eat this thing. So yeah, complement is part of the humoral arm. So whenever antibody attaches to bacteria, whatever, it's gonna, if it doesn't neutralize it, it's going to be part of the complement cascade. Like it's gonna be part of a complement. And basically, if you go down a little bit, okay. I mean, it comes up a little later, but like there's gonna be a portion that's gonna be the FC portion of the antibody. That's kind of what's gonna tell everybody, like the macrophages, okay, this is a antibody, and this is attaching to my receptor. So now I have to phagocytose whatever this is. So T cells are going to be, actually, let's go up a little bit. Okay, no, sorry, yeah, you can go down. All right, so yeah, innate immunity, we should already know it's non-specific. You have these things called toll-like receptors. I'm not going to go too into it right now, but that's basically what's telling a macrophage, like, these general things you should be able to know. So these general things you should be able to engulf. This is foreign, you should know it. When it comes to B cells and T cells, there's a crazy long, cascade of things that you have to do that basically says you can only attach to like a certain, like one thing. For B cells and T cells, you should only be able to attach to one thing and not yourself. Otherwise, you're going to be, you're going to have a lot of problems. You're going to have autoimmune disorders. But innate, you're going to be thinking about neutrophils, eosinophils, basophils, mast cells, NK cells, kind of like a little weird, but they still are considered innate. Macrophages are innate. They're part of the acute inflammation. When you get that cut and that inflammation is occurring on, that's innate immunity working. All right, so go down. Yeah, so adaptive immunity is after exposure, so around like 3 to 4 days afterward, if whatever you have is not going away, that's when you call in, the big guns. That's where you get the B cells and the T cells. If it's a virus is going to be, going directly into your cells. That's where you need T cells. T cells are going to be attacking cells that are like infected, that's basically, it's looking, so there's CD4 and CD8 T cells. I think if you go down, is going to be part of the adaptive immunity. So yeah, right here. So you have T cells. There's actually, let's go down a little bit more. T for thymus. Yeah. Okay. Yeah. Okay. We can go right here. So yeah. So there's CD4 T cells and there's CD8. CD4 is helper T cells. CD8 is cytotoxic T cells. That's cell-mediated immunity. It's specifically looking for cells that are infected. Type 4 hypersensitivity reaction, that's going a little too far, but that's something that happens. That's cell-mediated immunity. Basically, when you guys did your TB test, they were checking for if you have that cell-mediated immunity, if you have those T cells, because you wanted to make sure that you're not going to be getting tuberculosis, 10 years down the road. So, all right, when it comes to antibody and antigens, know that antibodies are binding to an antigen. These antigens tend to be on the outside of a whatever bacteria. These specific regions are called epitopes. Know about them. Dr. Mickle will bring them up again. These are the specific binding areas for the antibodies. Let's go down. Yeah, okay, so these are FAB arms and FC arms. So just remember that B cells and T cells are specific. They are specific for one thing, and that's what they're going to bind for forever. So that B cell is going to bind that one thing. And if it happens to bind the proper antigen that it needs to, that's when it's going to go into a germinal center. That's when it's going to proliferate. And that's what's going to happen when you start sending out those antibodies. So if it doesn't find its thing at some point, like it's just going to keep circulating. It's going to be in those lymph nodes. But the important thing is it's not doing itself. Know that the FAB. So I'm going to try, hopefully this is not all new to you. I'm sure you've all learned this, but I'm going to go into a little bit more. You have multiple types of antibodies. You have IgG, IgA, IgM, IgE, and IgD. The mnemonic is gamed. It's called gamed, like GAMED. G is the one that you guys have all throughout your body. That's going to be, that's the major player. IgG. IgA, that's in your mouth, your saliva, and your gut intestines. That's what you're going to find. IgM is a pentamer. It's the large one, and you usually have that in the beginning before you start making IgGs. IgE, that's for I always think of it when somebody's sneezing, you use it's because of IgE. That's what's going to help bind to mast cells, and that's what's going to cause sneezing and whatnot. And IgD is whatever, that's not that important. All right, so I kind of briefly went over some general things. Read the chapter about it for immuno, you should really know that. Now, going into muscles, you have triads and dyads. So triads are going to be in the skeletal muscle. You're going to have that the T cell, the T air, what is it, T zone?
T tubule.
Yeah, sorry, T tubules, the terminus cisterna, which is going to be on each side. That's going to tell you skeletal muscles, triads, and cardiac muscles. It's sort of just a T tubule and a cisterna. T for T, skeletal, triad, D for D, cardiac, dyad. If it helps you remember the short term, at least you got it down. All right, let's go down. Yeah, that's basically saying what I was saying. This is an important thing. This is in your hematopoiesis. A lot of people got this wrong when there was a question on it last year. Please do not be like those people. I'm telling you right now. So at the beginning of your life, when you're a little fetus, your erythropoiesis occurs through your yolk sac and liver and spleen. Those are making those red blood cells, the other ones, the fetal red blood cells. Once the baby's born, that's it. You don't need those fetal red blood cells. Everything gets turned off. And as you're getting closer to birth, it starts going to the bone marrow. Now, there was a question, I think it was last year, I don't remember. I was told about it. It's like gamma to beta. If that's the specific, you guys went over in biochem, right? I think so. I'm not sure. But basically, in postnatal life, the specific bones are going to be the vertebral bodies and the pelvis. That's where most of your erythropoiesis is occurring. The pelvis is huge. You guys have seen it. That's a lot of red blood cells are going to be made from there. And the sternum. Not a lot of that's a question that she could put on, which one of these gives the most erythropoiesis, which is the site of the hematopoiesis later on in life. It'll be tibia, femur, ribs, sternum. The answer is sternum. tibia and femur. Now people think, oh, the femur is the largest bone in the body, therefore it should be the most hematopoiesis in the life cycle. It's not. So make sure you guys know this. A lot of people get it wrong. Let's see, type of antigen receptors for B cells and T cells. All right, we can go over it fairly quickly. You have the heavy chains, two light chains for antibodies, and then you have the FC receptor. And then the T cell is kind of just like a single arm of the antibody. And it has a alpha, beta, or gamma delta, but gamma delta, you'll learn about it in immunology. The whole reason bringing this up is this is important later on. You're going to get hit with immunology really quick, and you're going to be like, what is going on? You're going to start seeing C3b, BB versus C3a, C3ba. It's crazy. It's going to get really hard. So they mention it now because you should know this. Going forward, I really recommend reading this immunology lecture again before you even start immuno. I don't know if you guys have already heard stories of immuno, but it's a very, very hard class. It requires a lot of time. But yeah, just know, I mean, I don't think it's that important. She really didn't go into like antibodies and T cell, like the receptors. That's more immuno. You can go down on T cell. There's T cell receptor. Yeah, you can keep going down. All right, so one thing that you should know is that for antibodies, they gotta know what an antigen looks like when it's outside. Like it has to know what it looks like normally on that bacteria. So it doesn't really get processed that much. So it's not linear. It could be the antigen binding site there could be multiple configurations, but it's not linear. So MHC type 1 is CD8, MHC type 2 is CD4. These are for T cells. These cells are going to take up a little bit of, protein inside the body, and that's going to bring it out to the T cell receptor, to bring it out to the MHCs. So the way your body knows, so all your cells have MHC1 receptors. That's your body's way of knowing, a T cell's way of knowing, like, hey, is this cell okay? Like, okay, I'm not binding to this, it's okay. If for some reason it's binding, like if for some reason it's, say you have cancer, which you stop showing MHC, or if you have an infection, a viral infection, all of a sudden MHC is going to start showing off these viral proteins. So CD8 cells are the cytotoxic T cells. These are the ones that are going to be doing the killing. The way I think of it is MHC type 1 times 8 is going to make 8, 2 times 4 is going to make 8. That's your way of knowing that's for T cells. Okay. MHC2 is for the cells that are going to be antigen presenting. So your macrophages, your dendritic cells, these are the ones going to be presenting cells to proteins or whatever antigens to your B cells. And then your B cells are going to be the ones that are going to be like, okay, now I got to start making antibodies. If I can bind it, I'm going to make antibodies. So I'm sorry if I hit you with a lot of immuno, but if you read the textbook, if you read the chapter, I kind of gave you like a dumbed down version of what that just said. This is all really important. It's all going to come back. If you learn it now, at least know a little bit of it now, you're going to walk in doing way better in immuno. So there will be questions. I don't know if it'll be specific, like talking about what, like the receptors, but do know IgG, IgA, IgM, IgE, and IgD. Do you know what they do? I showed up, I think last year, the question was like IgA, like which, and then it was like, what does it do? It's usually in your mouth, saliva, I think breast milk has IgA as well. So, whenever a baby's ingesting breast milk, you're passing on antibodies, and that's to help because babies' immune systems tend to be a lot weaker. So some of the last comments I'm going to make are that know what an appendix looks like. I don't remember if it was on the exam, but it's not on the image here. Know what an appendix looks like. There may be a question on it. Yeah, I don't think there should be anything else. But red pulp, white pulp, no spleen, but just take a look at the appendix. It's in chapter 14 of Junkera. Take a look at it. It might show up. Major hint, it might show up. So I don't know if you went over that, but it is part of your immune system. It is important. After you take antibiotics, there apparently the appendix is what gives out, a reserve of bacteria. And I think that should be it. Do you guys have any questions? I'm sorry, like we threw a lot at you, and we know you guys have like been with Muscala and this like right after, so like we apologize. It's a lot to throw at you. I know you guys probably just started studying because you had biochem yesterday. Take a look at. I don't know how Mikkel's lecture was. I didn't even look at it. Just read that chapter, at least that chapter for sure. Read that chapter. Yeah, if you have any questions, you can email us. If you have any questions right now, we'll answer them. But if not, you guys can go.
Quick question. My mic, like my audio cut out. You said what might come up on the exam? You said something about like hint.
Oh, I mean, like maybe, like I think it showed up last year, but just know what an appendix looks like. I'm not entirely sure if it's going to come up again. People got it wrong last year, so please at least know. She might take it off. To be quite honest.
Okay,
I
and
apologize.
you said the IgGs would show up as well too. Like they're really important in high yield.
That's a question that showed up last. I'm going off what showed up last year. I'm kind of going off my memory. So
Yeah,
that's why I'm not entirely sure. Like she might change it up, you never know. But the fact of the matter is there was a question from it. Yeah. So you guys can go now. If you have any other more questions, I'll stay for a little bit. But if not, you guys can go.
I think like
Thank you.
Sam said, just kind of go over the immune system thing. It was just one lecture. It's really Mickle giving an intro just because it goes hand in hand with like lymphatics and all that.
Yeah.
But you don't need to know it to the point that you feel like you're already an immunologist. Like go over it, know the basics. You'll get way more in depth next semester, but there will probably be like maybe a small handful of questions on it. So if you are familiar with the basic types of IgGs, where kind of they're located, and just stuff like that, you should be okay. I wouldn't go like super, super crazy and get super stressed out over it. Just,
Yeah.
blaze
So
through that chapter, like Sammy said, and I think you should be good.
yeah, I kind of went a little bit more in depth because when you start immuno next semester, like he really like expects you to know what I just said. So like at the end, like before you go into immuno, kind of look over this stuff. But for this exam, she's not going to make it that hard. She chooses the questions, so don't worry. She makes it. She doesn't choose anything that's not too hard. Again, I don't know what his lecture looked like. I don't think he's not my favorite professor, but just read the textbook for that. That's what I recommend.
And then just go over if Dr. Muscala gave you the pictures that she used in her review today, or if you just took pictures during her review, I would know her pictures and obviously go back through any of them that were in the slides from like Dr. Chusid or Dr. Muscala. Maybe glaze over Weeders, but I found Muscala's reviews to always be the most beneficial when it came to pictures. So I would know those. And yeah. And like Sammy said, if you guys have any other questions, you can email. I think a few of you have my number. So you can always text, anything like that.
Can I
Yeah,
ask
and you
a
guys should be all right. Oh, sorry. Go ahead.
Can I ask a quick question?
Yeah.
Yeah.
So I've gotten a question in the past where it says which bands or zones don't change, which ones get smaller in a sarcomere. Could you go
Mhm.
over which ones would get smaller or bigger,
Yeah.
like during
So,
Let me
contraction?
go.
which question was that?
It wasn't a direct question, but I'm going back to the picture of the sarcomere. If I can find it. So what's your question?
Um, like which zones would get smaller, which ones like wouldn't change? Or which ones would get bigger, if any do?
None of them get bigger. Here it is. So when you have like a muscle contraction, what's really happening is, the actin and myosin are kind of, coming together. Myosin will like swing its head around to contact actin and pull the bands closer together. I think I do know, I think I saw a question like this before too, and I never really kind of understood what it was asking, because really what's just happening is they're getting pulled in closer to each other. So it's not that there's like a large change in like length. It's just that they're getting pulled in closer. So like what's happening is I wish I could like, I don't know, touch the screen or something. But what's happening is these are going to be coming in closer to each other. So I believe if anything, the I band, the light one, is the one that looks like it would,
I think it's the H and the I, like, because when the muscles pull together, that H zone gets a little like it gets smaller because it's going to bring it together. It could also be the I. I remember a question like that, but it's generally I think it would be the H zone.
The A band would stay the same then, right?
I believe so. Because I know I saw this question before, and I don't know what book it was in, maybe BRS or something like that. So I'll go back and find it somewhere. And if anything, I'll just like send you an email or something like that. But I do believe the A band typically will stay about the same size, and the I band will kind of shrink just a little bit, because you're bringing in these like portions of the sarcomere closer to each other. And I do want to say, like he was saying, the appendix, know that picture? I do believe a picture like this showed up before, and it was something like, what is the actual sarcomere? So just be sure you know that the sarcomere goes from Z line to Z line.
Yeah, there was an image like that. Like it was gonna be like a bunch of arrows. It's gonna be like length of, and it's gonna be like what is the sarcomere, and like or something like that. It was something akin to that. This image, know everything about this image.
Okay, and I like tracked it down. The I band is the one that will get smaller.
It's the I band. Okay.
Yeah, yeah.
Thank you.
Because it's the Z lines that are coming in closer to each other. Okay, does that help?
Yes, thank you.
Okay. Anything else, guys?
I think no. I think the H remains the same, but
Mhm.
like it's the I band that would be like the better answer. Even if the H zone does get smaller, it would probably be a lot less compared to I.
All right. Do you guys have anything else before we all part ways?
Anything else, guys?
Thank you for your time.
All
All right.
right.
Yeah.
Good luck. If you have any questions, please let us know.
Thank you.
Mm-hmm.
All right.